Good evening, Dr. Pankaj, and may I please introduce you to the audience today. Dr. Pankaj Chaturvedi has a rich hair transplant experience and performs ultra-refined hair transplantation exclusively. He gets actively involved in every step of the hair transplant procedure, right from harvesting the follicles to slit mark making and placement of follicular units. Dr. Chaturvedi's skill and artistry can be seen in the hairline and crown patterns he creates for his patients, the results of which have been demonstrated in various conferences. He firmly believes that natural hairline design is critical to produce world-class results. In addition to his artistic eye, he uses lasers to assist in determining proper hairline placement on each patient. With his customized hair transplants, he has earned an excellent reputation worldwide, and his patients belong to different segments of the society, including socialities, actors, models, sportsmen, politicians, and various diplomats. The key factors to his fame and success are his knowledge, his strict quality standards, work ethics, and caring nature. He believes in thorough pre-treatment counseling and follow-ups. With this, Dr. Pankaj Chaturvedi, over to you.
Thank you. This brief CV was picked from my hair transplant website. So in addition, I'll tell you, I also have a keen interest in facial transformations, especially when it comes to injectables, energy-based devices, and minimally invasive procedures like thread lifts and fat grafting. So my today's lecture will be, today's talk will be based on injectables in current aesthetic practice. So a very warm good evening to all of you. And there is a small presentation which I'll be delivering, and because it'll be more pictorial so that you can understand in a better manner. And I'll be covering botulinum toxin and soft tissue fillers, and I'll be discussing like how they work and how to pick the right candidates and what all areas, what all concerns can be treated by using injectables. So I'll be sharing my screen.
Sure.
So today we are covering botulinum toxin, popularly known as Botox because of the first FDA cleared brand, and soft tissue fillers. So there are different types of toxins available. Botulinum toxin, they basically work on the neuromuscular junction. Main purpose of the botulinum toxin is to make the muscles little weaker so that you do not get undesirable expressions, right? So be it expression lines, be it hypertrophy of the muscles, be it hyperhidrosis, botulinum toxin delivers promising results. So there are three types of botulinum toxin available in the market: Ona botulinum toxin A, Inco botulinum toxin A, and Ebo botulinum toxin A. Efficacy wise, all three subtypes, they work very well. The only thing is the dosing, formulation, and the licensing is a little different. Now, how does botulinum toxin work? We know that muscle contraction requires the release of neurotransmitters, acetylcholine, from the neurons at the neuromuscular junction. Now, this released acetylcholine crosses the synaptic cleft and activates the receptors on the muscle fibers, resulting in muscle contraction. A very key component of acetylcholine release is the formation of snare complex, which basically is the target site for botulinum toxin type A. The botulinum toxin type A, which is there in the Botox, blocks the release of acetylcholine by cleaving SNAP25, preventing the formation of snare complex. So since there is no snare complex, the neuromuscular junction, the acetylcholine is not released there, and there is no muscular contraction. Indications of the botulinum toxin are facial aesthetics, hyperhidrosis, chronic migraine, blepharospasm, and muscle spasticity. When we talk about aesthetics, we mostly target facial aesthetics, hyperhidrosis, and to a certain extent, oculoplastic surgeons, they also use it in blepharospasm. US FDA approved indications of botulinum toxin are glabellar lines, crow's feet, and the forehead lines. Now, whenever we feel that these lines are altering the expression of the patient and the person um, is looking more anxious or more worried just because of the lines which are being formed, this is an indication of the Botox so that we can normalize the facial expressions so that the person looks what exactly he is from inside. So these are the indications of the Botox. There are few off-label uses of the Botox. One is Masseter hypertrophy, gummy smile, droopy smile, brow lift, bunny lines, parotid reduction, perioral rejuvenation, platysmal bands, and microbotox, which is also known as mesobotox. Now, how botulinum toxin is used? The first thing is patient assessment. We need to see whether patient requires botulinum toxin or not. Second is reconstitution of Botox. Botox comes as a freeze-dried powder and it has to be reconstituted. And third is injection. A sound knowledge of all these three gives the maximum patient outcome. Now, coming to the assessment part. First thing is when we evaluate the patient, we have to see that we have to do the assessment in the static condition as well as we need to see how the expressions are coming when the patient is making facial expressions, how the lines are coming, how the wrinkles are forming. So dynamic and static lines both has to be evaluated. Position and mobility of eyebrow, eyelid function and presence of excess skin, and volume loss in the mid and upper face. Why it is important? Because sometimes, especially, for example, if we talk about the peri-orbital rejuvenation or periocular rejuvenation, a lot of patients, they come with the concern of crow's feet. But when we examine, we find that it's not the crow's feet, it's exactly the laxity of the skin and the too much of skin at the under eye area. So when the patient smiles, because of the lift in the cheek, the skin collects there and gives an illusion of having wrinkles. So assessment is very important because if this patient will be injected with the Botox, the wrinkles will not change. To reconstitute the Botox, we use normal saline because it is not painful. Theoretically, we can also use distilled water, but distilled water injections are very painful. So we use normal saline, 0.9%. And then we sanitize the cap with alcohol. Then saline is injected in the vial. The dilution is, we normally use insulin syringe because it's like 40 units per ml. So we mix 1.25 ml of saline and 50 units vial of Botox. So Botox is available in 50, 100 and 200 vial. For the aesthetic purpose, we use 50 or 100 units vial. So in 50 units, we mix 1.25 ml of saline, and in 100, we mix 2.50 ml of saline, which makes 1 unit of Botox per unit of insulin syringe, or you can say 4 units per 0.1 ml if we use tuberculin syringe. Now coming to the injection points for glabellar lines. The glabellar lines, we first we do the markings, and in the markings we need to mark the areas like the glabella, then the procerus and the corrugator. So basically procerus is there in the glabella, then there is the corrugator muscle which is having a body as well as the tail. So each point is injected by 4 units of botulinum toxin. We use 30 gauge needle which is there in the insulin syringe, and so 1 injection in the procerus muscle at the midbrow and 2 injections in the corrugator each side. So total dose is 20 units. Coming to the crow's feet. So the crow's feet, depending on the severity of the crow's feet, we inject 5 units to 12 units per side. And for the safety issues, we palpate the orbital rim and we draw a line. So we usually keep a distance of 1.5 to 2 centimeters from the orbital rim, or you can basically see the lateral canthus, and you can draw a line of 2 centimeter, and you can start injecting from that side. So it should not go medial to that marking. And injections are given superficially. They should raise a blood. So we prefer to give intradermal injections. And we always point the needle away from the pupil, away from the mid-pupillary line. So it should be laterally and outwards. Coming to the treatment points for the forehead lines. So forehead lines, we inject using 10 to 20 units of Botox. And each point is given roughly 2 units. Again, the superficial injections, and we inject the upper half of the forehead muscle, because if we inject the lower half, this frontalis muscle also works as an elevator. So if you inject in the lower half, you can see the ptosis of the eyebrows, which is a very common problem if a wrong Botox is given to the patient. So these are the consensus guidelines regarding the dose which should be used in the patient. So the glabellar lines, we use 20 to 30 units in a female and 30 to 40 units in a male, because they have stronger glabellar complex. Forehead lines 10 to 20 units, and sometimes in men we need 20 to 30 units. Crow's feet 12 to 30 units per side, depending on the severity of crow's feet. Perioral lines 4 to 10 units. Now these lines are more common in Caucasians. They're not that common in Asians and Indian skin. Bunny lines just 2 to 5 units per side. Superficial injection 1 unit per point. And mentalis 2 to 8 units, 2 to 6 units in females and 2 to 8 units in men. Now I'll just show you a small video that how the Botox is administered. You can see I've done the markings of procerus, corrugator, and the tail of the corrugator, and as well as the frontalis area. So we often use a vibrating device to reduce the pain. So that is because of the gating theory of pain, because of vibration, the patient doesn't feel discomfort. So these are 4 units per site, and this is how these total 5 sites are injected using 20 units of botulinum toxin. So this is office-based procedure, and doesn't take much of time. We often apply numbing cream, or sometimes we do this procedure with the icing. And total time taken is roughly 10 to 15 minutes. There are minor precautions after injecting the Botox. We tell the patient not to massage the area, not to lie down for 2 hours. Do not do any kind of strenuous physical activity for 2 days. And do not go for any kind of heat-based treatment or steam or sauna or facial kind of procedure. Results, they start coming after 72 hours and they peak at 7th day. So we tell the patients to use more and more muscles, because we know that engagement of Botox with the receptor is better when muscles are active. And this is what we see after a week. You can see these are the expression lines before and after. And the forehead, you can see how shiny and smooth it is. Also, this patient was having a little bit of asymmetry in the eyebrows. So I have also done a bit of brow lift, and you can see there is a nice arch both the sides after the Botox. Botox has to be started when we do not see any static line on the forehead. But you'll see a lot of people coming to your office demanding for the Botox and having a lot of static lines. The Botox is not the treatment for the static lines. So if you look at the picture, there's a very deep line on the forehead. Now these patients, they require Botox as well as dermal fillers, because the static lines do not respond to the Botox. So this patient was treated with 70 units of Botox to take care of the muscular activity, and we use a thin filler. In this patient, I used Jovidum volvella to fill up this line. This result is after 2 weeks. Now coming to the masseter. Now A lot of people, they are chewers, they chew a lot. All the time they're having chewing gum or tobacco or gutka or pan. Sometimes um, gymmers who do a lot of weightlifting and do a lot of strenuous physical activity, they clench their teeth while lifting the weight. And a lot of people have bruxism where they grind their teeth while sleeping. So because of that, the masseter muscle, which is there at the angle of mandible, gets thicker and bulky. It gives a broad appearance to the face. And this is not a very desirable feature, especially in females. So many patients who visit my clinic with a bulky and heavy face, they look for a slimming treatment. And unfortunately, whenever they go to places which are places like giving slimming therapies, they don't see any change because this is not because of fat, this is because of muscle active, hypertrophic muscle. So Masseter, when treated with botulinum toxin, gives a very good response. So masseter hypertrophy is one of the very popular indications of Botox. So this patient, you can see the face is very broad from the top, and after injecting botulinum toxin in the masseter, we use 50 units, and this is the result after 6 months. You can see face is much more narrow, jawline is much more defined, she's much more slimmer. There are a few contraindications of the Botox. The contraindications are known hypersensitivity to the toxin, neuromuscular disorders, autoimmune disorders, cancers, pregnancy, lactation, or any active infection like herpes at the site. Now coming to the soft tissue fillers. Soft tissue fillers, the question is why? Why we need them? First, as we age, we lose volume, and loss of volume contributes in sagging and development of the folds. A lot of people have less volume at certain parts of their face and are not happy about their look because of their constitution, because of their build. This is how they are. So a lot of people, even in their early 20s, they come to me and say, doctor, I look very old and my face looks very saggy from the bottom. My under eye bags are visible. I am so young. What is the problem? The problem is your build. So volume loss is not only because of aging. Sometimes people do not have volume because of their genetic factors. And facial volumization, if done properly, can correct the volume loss and can give youthful appearance instantly. Now, what should be an ideal filler? We know that a couple of decades back, people used to get silicone injected, a lot of oils used to be injected, artificial material, collagen, many things came in the market. And why all these things came? Because there was a quest to get the ideal filler, which is biocompatible, non-inflammatory, non-immunogenic, non-carcinogenic, non-teratogenic, biodegradable, predictable, and giving natural results. These are the fillers which were used to be used, and a few of them are still being used. Collagen is there, calcium hydroxyapatite is there, which is also known as Redis, polyl lactic acid, which is known as Sculptra, quite popular in the United States, polymethyl methylacrylide, silicone, autologous fat, and hyaluronic acid. Now, these days, more than 90% fillers which are being used globally are hyaluronic acid fillers. And the reason is it is hypoallergic because we have hyaluronic acid in our body. Results are predictable. It is non-immunogenic, and it lasts for 1 year. So if you do the fillers and the person is not happy, the results are going to vanish after 1 year, or you can simply use an enzyme called as hyaluronic acid, just inject and the filler goes off. Unlike the other fillers which are synthetic in nature, you actually need to do microsurgeries to take the filler out. It's not an easy job. Now coming to the facial volumization. So we divide the face into different units when we talk about facial volumization. Mid face, lower face, and upper face. So mid face has cheeks, tear trough, and the nose. Lower face has got lips, chin, and jawline. And upper face like temples and forehead contouring. Now coming to the mid face. So mid face is injected when we see droop, when we see a deep nasolabial fold, we see under eye puffiness, we have to focus on the mid face. Earlier, a decade back, whenever people used to have this fold as a nasolabial line, people used to inject there. But now the approach has got changed. The root cause of this nasolabial fold is not the fold. The cause is the volume loss in the midface. So when there is volume loss in the midface, it droops down and causes ptosis. And the ptosis on the midface is seen in the form of the deep nasolabial fold. So we treat the cause, and the cause is midface. So here, if you can see, there are different protocols of doing mid-phase injections or facial fillers, and a few of them are uh, very popular because they use a very standardized technique to address the different points of the mid-phase. So in the mid-phase, we basically inject at the zygomatic arch, which is known as CK1, CK2, you can see the blue points, and then the medial part of the cheek, which is known as CK3, and pre-parotid area, which is known as CK5 and CK6. So these points are filled so that we can correct the midface. When we do the injections, we also have to understand that a wrong injection can cause embolism, and it can cause the tissue necrosis because of vascular occlusion. So a sound knowledge of major arteries of the face is very important. So these are the arteries, these are branches of facial artery. And if we know where the main facial arteries are, when the branches of the facial arteries are, we can avoid wrong injections, and we can run our practice safely. This is the tear trough where we deposit the product on the orbital rim to volumize the area. So again, there are 3 injections, which is, one is on the lateral, one is on the medial side, one is in the center. Now I'll show you a few results where the best part of the filler is that they give you on-table results. Results are very predictable, and patient is not supposed to wait to see that, okay, something is going to happen in weeks or months. No, you see on-table results instantly and immediately. So patients like it, and that is the reason behind the popularity of the fillers, that they solve the problem immediately. So this is the tear trough correction. You can see 3 prick marks are visible in the second picture. So those are the entry points where I inserted a cannula to deposit the product at the medial cheek as well as at the infraorbital area. Tear trough. So you can see the tired eyes are not looking that tired. Under eye area. So whenever we treat under eye, we also correct the medial part of the cheek, because often the fat loss or the volume loss in both the areas is present together. So if we do not give support to the cheek, we cannot correct the under eye. Now coming to the lower face. Okay, so lower face, we basically target the chin, we target the lips. These are the different points where we give the injections in the chin. This is the anatomy of the lower face, where we have to focus on certain points, certain arteries are there. So these arteries should be avoided, and these red points, C3 and C3. So C3 basically is a foramen from where few branches of facial artery they come. Injections, these points should be avoided. Most of these injections, they are given on the bone. So when we treat the chin area, injection has to be given on the bone because we need a lift. So for the lift, we have to deposit the product on a hard base, and that base is your mandible. So this is the correction of the chin as well as jaw enhancement. You can see after the treatment, patient is having very nice projection. We also did a bit of nose correction in this patient. Correction of the chin. So the moment we correct the chin, face becomes more harmonized, and a lot of patients who are not having good chin, they start noticing their jawline. So this is an instant result. And this patient actually came for the double chin removal. So when you do proper assessment of the face, you will realize that sometimes patients have double chin just because of a deficient chin. This is a full face correction where we have corrected the chin, the cheeks, the mid face, and the jawline. And if the fillers are done correctly, they even change the emotions which a face carries. So a face which is looking tired, little sad and droopy looks more cheerful and youthful. If you look at this face, you can see how the emotions of the face are changing before and after the treatment. The first face is looking droopy and as if something is hanging from the cheek and pulling it down. The patient is looking sad. And second picture, we can see the girl is looking more youthful. This is facial masculinization, where in men who need a more masculine face, we do the chin enhancement and bit of correction of the jawline to make the face more angular. So in men also, fillers are very, very popular. So here we did facial masculinization, where correction of the jawline and chin has been done to make him look more masculine. Again, the correction of the lower face, you can see immediately after the treatment, you can see the double chin has got vanished and the face is looking much more leaner and lifted. Look at this. Defined jawline, and nose is also looking smaller. Well-defined jawline. Now coming to the lips, these days, the craze of getting a pouch. So everywhere on Instagram, social media, you see girls clicking pictures with a pouch. And a lot of them, they approach dermatologists like us to get a nice real pouch. So lip fillers are quite popular. In addition, as we age, the volume from the lip goes down and the upper lip inwards and the lower lip towards. That gives a very sad and more mature kind of look. So when the upper lip is not there, when the upper lip is thin, the person looks too mature, and the overall expression is like a sad person or a person who is quite anxious and aged. So corrective lip fillers are there, and then fillers are there for the enhancement purpose. So these are the different points where we inject the lip fillers. It's a little complex, but doing lip filler is not easy. It's one of the most difficult area to inject, because the balance, the shape, the harmony, everything has to be kept in mind. And there's a very soft tissue. It swells very quickly. The moment you start injecting, it swells and becomes very difficult to assess whether it is actually you have filled it or it's just the swelling. So it requires a lot of practice and experience to create good lips. So this is a corrective lip filler. If you see the upper face, this is a very young girl, in her late 20s. And you can see the face looks sad. And the reason for this sadness is she's having an inverted smile. And the reason for the inverted smile is very, very thin lip and the droopy corners. And if you see the proportion of upper and lower lip is 1:4. So these patients, by injecting the lip filler the right area in a correct proportion, in the right volume, we make the lips more, you can say, more proportionate to the face, more proportionate to each other, and we restore the normal anatomy and the normal look. So by looking at this picture, nobody can say that patient has been treated by lip fillers. So this is a corrective lip filler. This is also a corrective lip filler. So if you see, the patient is smiling in the upper picture and only the central part is visible. Laterally, the lip has inverted completely. You cannot see the lips, and there are big gaps between the lips and the teeth, and even the teeth, they are too visible. And second smile is after we did her lip fillers. So lip fillers not only give you volume, they also improve the way you smile. Then there are lip fillers which are done for enhancement. A lot of patients, they want to pout, they want to look more glamorous. And of course, if it can be done without any side effects or without any discomfort, it should be done. So this is a lip filler where we have injected 1 ml of filler, and this is out. Another patient with the lip fillers. And if you see closely in this picture, you can just guess the age of the patient which is there in the upper picture and the lower one. So the lower face, you can see it's looking more youthful, younger, more happy. Though the patient in the first picture is smiling, but still you can see the lower face is looking much more youthful. Right? Now coming to the nose reshaping. So a lot of patients in our practice, they come with a complaint, with a concern of a bad nose. They want to make their nose better. Not everybody, but there are few patients who can be corrected non-surgically. Otherwise, when there are major issues, we prefer a rhinoplasty surgery. But patients having saddle nose or hump nose or having a broad tip or a droopy tip, they can be corrected without surgery and very, very efficiently. So I'll be sharing a few pictures, but this is an off-label use of fillers, not very popular, not very common either, and one of the most dangerous area to be injected with the fillers. But if the knowledge of the anatomy is good and if the injector is experienced, this is a very rewarding procedure. Okay. The reason why it is dangerous because this area has anastomosis between internal and external carotid arteries, and these are a lot of end arteries are also there. So sometimes there is a tissue damage in the form of necrosis of the tissue around the nose, and sometimes the complications like blindness are also there because of vascular occlusion. So in this patient, you can see we have done the nose reshaping. So there is a beaky nose with the droopy tip. We have done a tip lift and also corrected the saddle nose deformity. We did a lot of things in this patient, and I'll be showing the full picture, and I'll show you that how nicely fillers can give a good result. Look at this face. So here, the patient came with a concern of big nose and a double chin. Double chin, we did assessment, we found that no double chin. The main issue is the lower face is poorly developed. So we did correction of the chin, the jawline, and you can see there is no double chin in the second picture. We also corrected a little bit of volume loss, which was there in the mid face, and we also did the correction of the nose. And you can see this is just after 1 hour of the procedure. This is again the correction of nose. So the first picture was taken 2 years back, and the second picture when she came last year for her fillers, and this picture is just after giving her fillers for the third time. So this is like a serial pictures. You can see the fillers, they have lasted for more than 1 year in her case, and a beautiful correction of saddle nose. Nose has become sharper and lifted. So I want to give a message that injectables, they have a very important role in aesthetic practice, and be it surgical practice or non-surgical practice, virtually nobody can stay into aesthetic practice without injectables. So now we are stopping the screen sharing.